Caribbean has the highest rates of premature death from the 4 major NCDs. That is diabetes, diseases of the heart, cancer, and chronic respiratory diseases. 3 of every 4 deaths are due to these illnesses. And 73% of all deaths occur prematurely in people between the ages of 30 and 69 years. NCDs are crippling our economy, our productivity, and our health. We need a whole of government and a whole of society approach, bringing together health, trade, agriculture, food industry, education, and other sectors to effectively address NCDs and the related risk factors.
So in the region of the Americas, the Caribbean countries have the highest death rate from NCDs of any of the other regions. And more importantly, they have the highest rate of premature mortality. What that is deaths from NCDs between the age of 30 and 69 years. And those deaths are really tragic because everybody should get their 70. But in some countries, we find that 3/4 of the deaths of people below the age of 70 are from NCDs.
Trinidad and Tobago has spent $40 billion in healthcare from 2005 to 2016. But are we healthier? The answer is no. Unless we get our 2 main groupings in Trinidad to understand that whilst you can't control your genetics, you can control your surroundings, and you could control this deadly relationship you have between your hand and your mouth. That is, you could control what your hand picks up from your plate and shovels into your mouth. That, my friends, is what you have control over. Those are the type of health policies that we will be driven by over the next 5 years as we seek an intervention, a serious intervention, not in terms of medication, not in terms of amputating legs, but in terms of culture. Our culture predisposes us to this thorny crown in Trinidad and Tobago of being a leader where we should not be a leader.
I served as Minister of Health in Barbados for about 4.5 years. And during my tenure there, we had a very frontal approach towards NCDs. There's several things we did back then, quite frankly. One was to raise the level of awareness of NCDs. And that is such a critical factor because you cannot expect to treat the public health care issues like these without the public being aware that there is a problem. And then enlightening the public at what you can do at the individual, community, and national level to address them. So that the overarching thing was education, sharing information, letting people know the consequences and the costs of their actions. And then there were specific activities we did, such as we formed our drug service, we banned smoking in public places, banned the sale of tobacco products to minors, tackled some of the issues regarding alcohol consumption. So it was a variety of factors that have led, I guess, in my case, to having that experience in the public healthcare system.
All I say to people, when you consume your fast food, make sure you eat a lot of fruits and vegetables, consume it in moderation, limit your salt, limit your sugar, drink a lot of water, and remember, our healthy foods that are grown in the Caribbean are some of the best foods and healthy. And in its fresh form, it is very good for your health, and it's also a very good weapon against NCDs.
The action plan of the workshop is a plan for action. A plan that speaks to benefits to real people on the ground in each member state.
It's like a meeting of the minds. And what I really appreciate in terms of reviewing the Port of Spain Declaration, that we don't only have health people. We have people from other departments, people from other areas, and very importantly, the role of civil society, which has been able to drive, policy, and we have been able to support various initiatives around the NCDs.
Because next year is the 10th anniversary of this historic Port of Spain Declaration, we're actually going to be going through the chief medical officers to the ministers of health and to the heads of government and asking them to do 3 or 4 very specific things, almost as a way of marking the 10th anniversary of Port of Spain. And we're hoping that if we choose these things correctly, and if the ministers and the prime ministers agree, then some of those interventions can help to move the agenda forward.